All right, we are live. You guys ready?
As
John,
I
you
I'm
will
a
got your
be,
Russ.
coffee? You got your coffee?
I have my coffee.
Thank God. All
I
right.
have my fizzy water.
And I have my dietary 7-Up. All right.
That sounds believable, Katie.
You know,
Okay.
we're already going there.
All
So you
right.
have to be very composed, otherwise you'll give it away of what
You
you're
guys are
actually
the
drinking.
worst. All right, let's just do the introduction.
Sorry.
Started.
I'll
All right.
leave that to
So
you.
Mm-hmm.
thank you very much. All right. So with me here today, Dr. John Grayson, noted author, OCD therapist, and all around sort of OCD guru. Can I say that, John? Yeah, he doesn't like that.
I don't get to
Uh,
control anything.
I know that's true. Is here with us today. And then Mr. Zach Pacha, who is wonderful OCD therapist, also co-chair of the National Social Anxiety Center. And I'm Dr. Katy Manetta. And we're here to talk about all things OCD related and to hopefully try to answer some questions and provide some good information. I just want to make it clear that this isn't a substitute at all for mental health treatment, and that if you feel that you're having a mental health crisis, that you should go to your nearest emergency room or dial 911. This is intended to be informational and hopefully entertaining, but I don't know, we'll see. And let's start. So we
At
have
least
a few
to us.
questions. Yeah. I'm hoping that my comments are turned on. I hope they are. Oh, show
Mine are,
comments.
maybe.
Let's see.
Comments.
Let me
Oh,
see.
there we
Yours
go.
are?
Well, I don't know. Here, let's see.
Oh no.
Oh,
You
that's the
trying
private chat.
something?
I'm not
Okay.
going to try. It's better if I don't.
Okay. Well, we'll all right, we'll give it a try. Hopefully the comments won't get too disruptive, and if they do, then I'll shut them off. But
I don't think
okay, so the first question that we're fielding, and I think it's a really good one and one that I think we as OCD therapists get a lot, is this idea of and this was posed to me by someone in an online OCD recovery group, and they asked, is paranoia common with harm and false memory OCD and meta OCD? Now I just want to say I haven't actually heard the term meta
Me
OCD.
either. I need to
Zach has
know.
not either, but John has. And so, John, why don't you first sort of enlighten us about what meta OCD
I'm gonna
is,
write it
and we'll
down too.
discuss this.
I mean, it has a few different variations, but the general way is obsessing about obsessing. So my concern is I, I I had one guy who would talk about he would keep thinking about the microwave in his home, and he'd have these images of the microwave opening up and fire bursting out and burning his house down. And it would seem like his fear was the house is going to burn down. He actually didn't worry about that at all. I mean, he might have worried about that at some point in his thing, but his concern when that thought came is now I'm going to start obsessing. So his fear consequences, he would be obsessing about obsessing. And what can I make sure I would, what can I do to make sure I don't start obsessing? Because that's the problem. And so actually at that time, he couldn't figure out, do I do therapy to stop obsessing or do I rituals to stop obsessing? And of course, the goal wasn't to stop obsessing. But so generally it's obsessing about obsessing. So the feared consequences, I'm worrying about my worrying and I may just be as simple as that's what I'm worrying about, or I may look like another form of OCD, but I'm most concerned about that I'm obsessing, not that I'm some other thing is going to go wrong,
You
unless
know,
they mean
that's
something completely different, in which case I'm wrong.
Well, the other thing that this brings to mind is that there are some people with OCD that their fears are really related to sort of like what they're thinking at any given time, right?
Mhm.
And so like, um or what they're feeling at any given time. Am I obsessing? Am I feeling good? Am I feeling present? That's when I hear a lot, right? Am
Am
I
I
feeling
feeling the right
present?
thing?
Am I feeling the right
Yeah.
thing?
Am
You
I
know, this is
feeling
a
the way I should be feeling?
Oh, that's such a good way to put it, because that is, I think, a really common sort of thought that some OCD people might have, some people with OCD might have. And so, how do we manage those kinds of thoughts? So, let's say that we have this fear of, what if I'm feeling the wrong thing? What if I'm not present? You know, what if I should be feeling happy and I'm really just thinking about my thoughts when I should be feeling happy and present in this moment?
I
I'm
love
gonna
how we
do.
stop. I'll stop
I'm
and
sorry.
read it.
I was looking at it because
Oh, nice.
Oops.
There it's on there.
this
Yeah.
was relevant to our question.
Hmm.
So you can flash it
Ooh.
up. Somebody flashed it
Okay,
up
I will. Let's do it.
Thank you.
There it is.
because I feel like
This is
this
cool.
is relevant to what we're talking about.
Yeah.
Yeah.
And so I have a few questions that I would ask Lewis, which you don't have to answer online, but I'm going to present two situations. Situation one is, imagine that you are having the intrusive thoughts and they are just slamming into you. It's like one of the worst occasions possible. It's really horrible. And I say to you, and for some magic reason, this would be true in this scenario, that Lewis, for the next 5 minutes, it's going to slam into you and then it's going to stop forever. And for some reason, we both know that's true. How would you be? Most people would say, oh, I could put up with that. Now, first of all, that is amazing because let's face it, that first 5 minutes, it's the same whether it's 5 minutes or 5 hours. And all that's changed is this piece of cognitive knowledge. Now, I happen to agree. And if I were to ask you why, I'd say, well, because it's not so long. I'm really confident that if I subject you to the most painful physical torture I can come up with, 5 seconds would be not tolerable, let alone 5 minutes. So it's more than just the time. Now, here's another situation. Imagine that someone close to you whom you love has died. Your child, your spouse, your sister, someone really close. And it's 3 weeks later. And I would ask these three questions. 3 weeks after they've died, what thoughts of them pop into your head? Yeah. Would those thoughts be upsetting? I would think so. And might it even interfere with what you're doing? Yes. Would you and most people call that OCD? And most people would say, no, that's not OCD.
That's normal.
That's what they would say. So
Yeah.
my question would be, these two situations, the 5 minute situation and how you would be 3 weeks after a loved one died, are the same.
Now,
So
John,
wait,
are you
next
going to
time somebody
explain what?
dies in
Go
my
ahead.
life, 3 weeks
Well,
later, I
no,
have
that
OCD.
whenever I do this clinically, that is followed by that dramatic pause until somebody finally says, like, what? And both situations, without realizing it, you made a decision. In the case of the 5 minute situation, you've decided, I'm willing to put up with this for 5 minutes. I'm not willing forever, but I'm willing for 5 minutes. But that changes how you feel about it. It suddenly became more tolerable. You made a decision, it's okay. And in the case of the death, oh, I'll put up with that because it's normal. I
Right.
don't want this an abnormal thing, but that's normal, so that can be there. Right after 9/11, I had a support group, and I asked those three questions about 9/11. How many is it popping in your head? Is it interfering with what you're doing? Is it upsetting? Is it OCD or not? Everybody in the group said it's not OCD except for one person. How did he differ than everyone else? I don't want to have those thoughts. Oh my God, it's being so difficult. I see the people dropping out of the building going on and on. It's like, and really 1 week after 9/11, good luck not thinking about it since it was on every
Right.
news channel 24/7.
Right.
So, finding peace with the intrusive thoughts, um, and think about losing a loved one. What is finding peace with losing a loved one?
Mm-hmm.
It's like, oh, and the thing is that, when we lose somebody, we all start in denial. Denial is whenever I compare reality to a fantasy. So when I lose a loved one, the statement of denial is life would be better if they were still here. Well, that's never happening. That's a fantasy. But the thing about coping with death that's really important is coping and accepting is not a decision, it's a process. I don't care who you are, you're starting out in denial. And so, I mean, if I had somebody who lost them, they'd say, well, this next year, it's going to be a horrible year. You are going to spend a lot of time comparing every moment to how much better it would be if they were still here. And if we get you to mourn and go to acceptance, what will happen is you will still cry and miss them. There'll still be a hole in your heart. But you'll also be living life not comparing every moment to how much better it would be if they were still here. I had actually told this to a couple who had lost two kids, and the dad had gone on to write a book about grieving. And he wrote about that session. And he said, when the therapist told me that, I thought, fuck him. I'm never going to stop wishing my kids alive. And then he wrote, but now, 2 years later, I've come to realize it doesn't do me or them any good to wish them alive. And so, in terms of finding peace with intrusive thoughts, I would have to go to mindfulness. And mindfulness is not peace. Mindfulness is doing two things at once. It's doing and, not or. So, this couple who lost the two kids, there was going to be a meteor shower one night. This was about 2 years after the kids were murdered. And so at midnight, they go out to watch the meteor shower and they lay down. And as soon as they lay down, they both burst into tears because these two kids, this 14 and 17-year-old, would have been there happily watching with them. I said to them, was it a pretty meteor shower? They said, yeah. Are you sorry that you saw it? No. The truth. It's a beautiful meteor shower and it's horrible. Kids are murdered. So intrusive thoughts, well, they might be painful thoughts, but they're only really a problem. And actually, I would argue there's no such thing as an intrusive thoughts, because if I look at the intrusive thoughts that people with OCD talk about having, it turns out non-OCD people have those thoughts. What makes a thought an OCD thought? If I do one of two things, I want to know what it means, or I want it to stop. You do either of those, it's gone. So it's coming to like, oh, yeah, I'm going to have that intrusive thought. And I'm not going to keep comparing my life to the fantasy where it's not there. And you know what? I can do both at once. And if I practice that, I get to a point where, all right, it's that pain in the ass thought. Fine, it's there, whatever. And I can also enjoy something.
So, John, I just wanted to sort of underscore a few of the themes of what you just said, just so for people that are sort of joining us late or need a reminder of what you just said, because you covered a lot of important topics in what you just described. So,
Thank you.
one of them is this idea that part of the way that thoughts feel intrusive or feel intolerable to us is the way that we interpret the presence of those thoughts. So the difference between that 5 minutes versus forever versus, the death of a loved one, right? It's like all of those situations, we're telling ourselves something. We're either telling ourselves it's okay to have the thought, it's normal to feel this way, or we're telling ourselves it's intolerable. I can't continue feeling like this. This is the worst ever. Nobody else feels like this. And so this is where, and I think this is right now, right? A real, I think, fissure or controversy that's happening in our field is the idea of the relevance of cognitive interventions for OCD, because there are a lot of researchers out there right now that are arguing that behavioral interventions really should dominate. So it should be exposure without really a lot of discussion of these cognitive interventions. Just wanted to throw that out there. And so I just wanted to highlight all the things that John just said, because I think those are so important, and also discuss that this people could hear different things from different therapists that, that they're going
And,
to.
and that's a big problem because, I think with everything, it's like, how much am I modifying my intervention to the needs of somebody with OCD?
Mm-hmm.
So that I'm certainly doing cognitive interventions, but I'm doing it appropriate OCD. Like traditional cognitive therapy would say I have to focus on the
Evidence.
not well, or the evidence, or like what are the cognitive mistakes that I'm making?
Right.
Now, the thing is, I have to pick the cognitive mistake that that person is making, not the one I think they're making. So, if they're going to say like, well, that probably won't happen, they're treating it as a threat estimation problem. It's not likely to happen, so don't worry about it. But with OCD, it's not a threat estimation problem. It's intolerance of uncertainty. It's got to be all or none. So if I treat threat estimation, well, I'm doing the wrong intervention. So it's not so much cognitive or not cognitive. It's like how much is your intervention targeted towards the problem? And the idea of just doing a behavioral intervention absent any attention to cognitive, that might work pretty well if we were rats. Although I hate to kind of cast aspersions on rats, mental
On
capability,
rats.
but I really feel
Right.
very confident that
I thought he was going to say.
I don't know how to do cognitive therapy with rats, but I find a critical
John,
feature
I
for
thought you were going
people.
to say that you didn't want to cast aspersions on behavior, people that were purely behavior, but then you said I don't want to cast aspersions on rats.
Yeah, well, you've
That
got my
too.
bias down very well, Katie. Um, so I feel like because I've had, but and really Louis' question really hits it, because if I say I can't have this, I've had people where therapy succeeds or fails based on, have I convinced them that the goal is to learn to live with the thoughts or not? Now, saying the goal is to learn to live with them doesn't fix it. We still got to do
No.
all the treatment. But
Yeah,
as long as the measure of treatment is I don't have the thoughts, those people fail.
that's right.
And
Right.
so it can be it can be a gradual process, and we talk about there, but I could go on about this, about what we do in those cases for those people, but suffice it to say that choosing a therapy call, that doesn't fix it. That just gives me a start. It's kind of like deciding to go to getting therapy. You have to decide you want therapy. Otherwise, the odds of you ending up in my office are really slim. But that decision just gets you to the office. It doesn't do
Not
anything
zero,
else.
just slim.
Right. Right.
Yeah.
Well,
Yeah.
Yeah.
yeah. Well,
Yeah.
I have had people
Could
walk
be
in. It's like,
random.
what the hell are you doing here? We didn't have an appointment. Get out.
Right.
But you know, you know, that's a beginning decision, and then we have to do all the work. So
Years ago, Christine Podesky said this, and I thought it was so astute that, so often when anxious patients or patients with OCD come into our office, right, they're almost watching the clock and saying, it's been 10 minutes and I'm still anxious. This is not working, right? And
right,
it's
because it takes a
important.
half hour.
Well, it's important for people to appreciate that the goal of therapy is not to remove anxiety. The goal of therapy is not to remove the obsessive thought. And John mentioned that, and I wanted to underscore that as well, because I think that's important to know.
I want to thank John for saying that. What was it about that
I don't know, but
trustworthy?
with you, I never know it's going to be serious or not. But just go for it.
This one actually is serious for once.
Okay.
Uh, so I basically had almost given up on the fact that we don't have to call them intrusive thoughts, people, because maybe I listened to you at some point over the years, and so reminding it like, no, they're just thoughts. All of them are thoughts,
Right.
and it's how we respond to them. So
And I really want to be clear. That thought is not original with me.
Right.
So I can't take credit for it, but I certainly endorse it. Sure.
However, we do have to be cautious because sometimes when we say a thought is just a thought,
Oh, no, no,
there
no,
is,
no, no, no. Sorry. No, never.
boop
I
boop
never,
boop.
never,
let's
never
be clear.
say that,
Good.
because although
Right.
that is something they say and act, and it has to do with
Yeah.
the idea of diffusion, and has to do with like learning to separate thoughts from reality. But part of diffusing is that I think about my thoughts in a non-judgmental way.
Right.
And for people with OCD to say a thought is just a thought is a judgment, because I'm really
It's a
wishing it's a
judgment.
thought, because if it is just a thought, then I don't have to worry about it. So in
The function of
OCD,
it's completely different when they're
they
saying
never
it
say
that way.
that. Now,
Yeah.
if you're
Right.
talking about living with uncertainty and that everything has some probability, that really contributes to I was going to say to confusion, to diffusion, because if everything's uncertain, my thought isn't proof one way or the other. It is a non-judgmental way to look at a thought.
Right. I like that distinction. Should we switch over and just show Lewis's follow-up comment here? But then we do have other questions to get to. So
Mhm.
Lewis says, "Thank you, John. I may make the mistake. I'm generally believing doing compulsions to keep harm away from me or contaminating my children." Yeah, and this is where,
Oh,
Lewis, you're doing a
I'm
great
just gonna,
job.
yeah,
What I was going to say, he's doing a great job of part of what we have to do is that it's treatment for OCD is can be very difficult. It can be really challenging to learn to live with uncertainty, and so we always have to be remembering what reasons we have for doing this treatment, why it is that we're doing what we're doing, and Lewis outlined it beautifully,
yeah.
the
And
harm that we're causing our children.
if I reinterpret what Lewis said is because he had two choices. One is his fear that he's harming his children with contamination, and
Right.
one is he's harming his children with behaving in an OCD way. And in a statistical way, we know that behaving OCD is going to mess his children up psychologically, or at least have them lose all respect for him. And we know that the things he's trying to protect them from contamination wise are less likely to happen. So he's making a value driven choice of which value to pick. Am I going to listen to the OC demon, or am I going to listen to love? So he's choosing love over fear. And it's not easy, but
Yeah,
he's
it's not
decided
easy.
that love is going to be more important in my life.
I love the way you put that, John, choosing love over fear. Love that. Okay, I'm gonna hide this comment and then let's talk
That's
about,
cool that we can do the comments on there like that.
yeah, isn't that nice? All right, let me find our other comment that we were gonna address today. And this came from
Can I get
Valentina, who
okay?
is a wonderful contributor to
She
our program
basically is
here.
our writer for the show. Now that I think about it.
Zach, you're
You
funny.
know what?
All right,
I think she should get as much money as we do for the show.
which is the big zero, right?
That's why I'm
No, the
offering it.
check's in the mail. It's always in the
Yeah.
mail. Come on, we've been over this.
Yeah, Zach keeps telling John that the check is in the mail. That's why he keeps participating, right?
Mm-hmm.
All right. Sidebar. Back to business. So Valentina says, I often throw away contaminated items, thinking that my health is more important than money. If ACT says, and so for people that don't know what ACT is, it's acceptance and commitment therapy. So if ACT says we should focus on our values, then how can I separate my OCD rituals from prudent actions that someone who values their health would take to avoid carcinogens?
Can I answer that?
Well,
Can
I
I go
want Zach
first,
to
though?
start with this one. Zach's going to go first on this one.
I promise
That's
I will
fair.
dovetail it over to you. Okay, so if we are going by ACT values, first off, let's define what we mean by what a value actually is. So, one, it has to be an ongoing action. So, health is not necessarily an ongoing action, but acting in a way that promotes being healthy, okay, then also it has to be a global quality. So it's something that takes a bunch of different patterns and sort of unites them. So yes, I could be healthy, but how am I doing it? Or if I'm playing a sport, or if I'm playing guitar, I'm not just playing guitar. How can I do it in what's a global quality? Well, am I doing it mindfully, skillfully, etc. Right? And then the last one is chosen. It can't be I'm resignated to my health or cleanliness, that sort of thing. So I
Sort
would
of like
argue,
feeling forced to do it, you mean?
yeah, exactly.
Yeah.
Yeah, resignation. So I don't know if that actually fits. It really doesn't seem like it. I think there's probably a better description or a better way to describe what she is trying to get at for her value. So that would be one thing I would be like, let me push you on that for a second, because I don't think that's gonna fly. And another important part about values are you have to prioritize them. And so that part always comes up usually if we're talking about some of the things that come up with things related to health or cleanliness or safety or things like
We
that.
might want to avoid carcinogens, but then the question becomes, at what cost? Does that end up betraying other values that we have about how we treat our loved ones? And in
Yeah.
Valentina's case, right, her stealing her grandmother's
Oh, the
thermometer.
mercury. Yes.
And you
Forgot about
remember,
that.
poor grandma is about to have her thermometer stolen. And so, Valentina has to ask herself that important question, like, what's more important?
Yeah.
Grandma, potentially thinking somebody's stealing from her versus,
Yeah.
prioritizing health.
Yeah. And
Yeah.
Lewis is more or less talking about that with his example too.
Right. Yeah.
Now, John, can you talk about responsibility?
Yeah. It's
Well,
gonna
I know what John's going to say. John, are you going to talk about all the ways that she's probably not really that, like, she's not being complete in her focus on getting rid of carcinogens? Are you
No,
going to talk about that?
I am
Okay,
going to talk
sorry.
about that, but that's not where I'm starting.
All right, start somewhere else then.
Because, most people, and I don't know if Valentina is guilty of this, but normally most people think of responsibility and their definition almost always involves the word should. And
That
I
would
always,
mean not chosen and not desired. So
well, to me, the word should is always somebody waving their finger at you, telling you that you're bad.
absolutely.
And
Yeah.
so I have a definition of responsibility. It's a two-part definition that does not use the word should at all. So responsibility is taking the action to accomplish the goals that you have, which I kind of love. It's amoral. I want money for my family. Maybe I'll steal. It doesn't matter. I'm just, it's that. The second part is that I am willing to accept the consequences of my actions.
Hmm.
Because if I'm not willing to do that, I'm not being responsible. So I used to work with guys on federal probation and parole. And I had the responsible criminals and the irresponsible criminals. The responsible guys, I mean, they were not happy about being in prison. And a lot of them were like, they're not going to ever do that stuff again because they don't feel like going back to prison. Others, they're going to do that stuff again. But they accepted that as, yeah, I do this. Everybody I know is in prison. I may hate it, but like, yeah, of course I'm here. The irresponsible guys would complain and bitch about how unfair it was in prison, that they really, they weren't in for the crime they committed, which was actually true a lot of times. The feds came after them and got them on a crime they didn't quite commit, but they were doing a lot of illegal stuff. And it's like everybody is in prison. So they were not responsible because although they were, doing the criminal activity for the reasons they had, they weren't willing to accept the consequences. I'm living in LA. If I want to be an actor, but I'm only going to be happy in a Hollywood movie, then that's irresponsible. Because bottom line is that is probably not happening. So that's just not a responsible thing to do. If I want to be an actor and it's like, I'll try for 5 years, cool. Or if I want to be an actor and like, I'm okay if I can act anywhere, even community theater, I just love acting, fine. I'll take the really, I'll take the Hollywood movie, but my happiness does not depend on that or nothing. So I have to be willing to accept the consequences of what my choice is, the likely ones. So with Valentina, going back to her, I feel like, there's a number of ways in which she has, what she's calling a value. She's really good at lying to herself. I mean, like the mercury, first of all, you can't get cancer from the, the
No
blonde or break.
offense, no offense to Valentina, because we really enjoy her participation.
Well, I
And
said
so,
she's lying to herself, not us.
okay, all right,
Right.
good.
Yeah. Because like, yeah, break a thermometer. Sorry, you're not getting cancer from that. That's not the way mercury, you get cancer from it. And the quantity of mercury she's likely to swallow would not give cancer, but it's also likely to not be harmful. Not that I recommend doing it, when we're saying odds. Everything is odds. So, you know, we have to look at the odds of all the things that she's calling health related. And what are the odds of the bad thing happening? How much is she potentially significantly lowering the odds? So we have the cost of that, because let's face it, generally in OCD, I'm doing a lot of things that have a really low probability. And as Katie was bringing up, like, if she's talking about carcinogens, I don't know where Valentina lives, but if she's not living in the woods in Montana, okay, how many carcinogens are in your environment? And to keep carcinogens out of your home completely and only
Hey,
by
John,
products. Yeah.
I'm in Minnesota right now. It's smoky as hell from wildfires, so you're not even safe living in the middle of nowhere. Okay.
Yeah, which of course is actually more carcinogenic than not LA, because we've got the fires and everything else.
Right?
But the point is, are you living in a house where you have air filters currently running constantly? And since your house, that's not really good enough, because your house is not airtight. So you have to make sure that you have air filters so that no outside air can get in. So you're going to have to spend about $50,000 to $100,000 to have like this air in your house be clean, and you can't go outside unless you're wearing a heavy duty respirator. If you have carpets in your house, how are they glued to the floor? Do you know what kind of glue is used? And the pressure treated wood that was used to make your house, do you know what kind of chemicals were used for that? Because there's some that are potentially carcinogenic. And I can go down the list and I can guarantee there are carcinogens in your house. But here's the really good news. I often upset people by saying, do you know what saves our children? Luck. Most of the time, they don't crack their head falling down the stairs. They don't get kidnapped. They don't get a dread disease. But sometimes it happens. So most of the time, most of the things you're avoiding, Valentina, yes, they might raise the odds of cancer, but not to a point where everybody in the world's dying of cancer. Versus what you do to them and yourself, because I would ask you, what do you lose in your life to OCD? Time, looking crazy, all these things. What have you lost? How do you hurt your family with your OCD? Being angry at them when they don't do your things, depriving them of things, not being present because you're in your head up in OCD land, and how many other things. And how much are you not the woman you want to be and can be because you let OCD rule you? Those are all values also. So it turns out I don't get to have any nice pure value where it's like all good or bad. Everything is a gain or a loss. So are you willing to lose all that for something that has a low probability of helping, and they might get cancer anyway? So it's kind of like all this work and you don't necessarily get the prize, because the only thing any of us have is now. The past, nice memory, future, hope. I only have now. Right now, I have no idea if my family's alive. My whole life, this may or may not be sad, is Katie and Zach.
What a way to go out, though.
Like that's all I have. I'm hoping my wife's alive when I get home. The only time I get to have Kathy is when I'm with her.
Yeah.
With Vanessa, Valentina.
Valentina.
Her too.
You don't even get to that because you're in OCD land. So
Yeah.
when you're talking about values, you got to think about all the values you have. And, you're doing low probability health values. And so sometimes people use this value argument, and it's partially a lie, because really it's like, well, this makes me uncomfortable. And then they'll base it on these other things, because you said these proven things about carcinogens.
Prudent was the word
Yeah.
she
But
used.
but since almost no one does them to the level she's doing them,
Right.
obviously, no, the world disagrees with you. And if I want to read labels that are worried about getting lawsuits, sure, they have a lot of things that say do and not do. But you do it 100%? And I guarantee that if you could write down all your cancer avoiding things, I'm going to find flaws of why you're still getting cancer. If you're going to say, well, you're lowering the odds, you might be. I'm not even sure about that. But the question is significantly, because if I lower the odds from from 1 in 100,000 to 1 in 1 million, well, that's a 10 times decrease in odds. But you know what? I'm not spending all my money on a lottery ticket that's 1 in 100,000 or 1 in 1 million. So
Right.
it's just,
Yeah.
compared to damaging your kids, if they're going to have OCD, then you're teaching them it's hopeless because they look at you. And if they're not
Right.
going to have OCD, then you're just going to become like the crazy mom not worth listening to.
And
I'd rather have you take the things that are worth it in you so that they can appreciate them and you can give them some strength, and I'll shut up.
I want us to direct this conversation to the broader issue that I think Valentina brings up that I think is important for us to address is this idea of, you know, normal. How do we define normal in OCD? And I would argue that if Valentina was saying, well, I don't smoke, and if I was really risking cancer, I would smoke or something. Yeah, I think that's something we could sort of all agree on, that if you smoke, there's a greater chance that you could get cancer from smoking. But the
Odds are still in your
question,
favor, but it goes up.
that's true. It goes up, but that might be sort of in that category of kind of normal, prudent, right? So how do we sort of distinguish when people, how do we kind of get to that? And I think, what is it that you've referred to it as, John? Sort of like the average person, or the sort of, I can't remember what you
So
described it
I would
as.
suggest that nobody here wants to be normal, because people with OCD tend to have above average intelligence. Normal intelligence is dumber than all of them. So nobody wants to do that. Average salary is kind of low, so everybody would prefer to be higher. Average marriage is divorce. So I would argue, why would anybody shoot so low as to want that? And the thing is, in terms of normal, the question is, do most people seem to take all of these precautions? And they don't.
Right.
I always like to, in terms of like normal and prudent things, like I do remember, when I was a kid, because I'm so old, like, Purell didn't exist, so many of my friends had lost their mothers because, they couldn't decontaminate the shopping carts. So they died.
John's being funny. There was not a rash of dying mothers because they couldn't
You
decontaminate
could have
the
waited a
shopping.
little bit more to see if somebody made a comment. Like,
I don't want people to be frightened. People
So,
are going to
all
go
right,
off and
friends.
start buying
maybe I'm going to die
Purell
from
then.
touching a shopping cart. But the
That's right.
fact is, it's a pretty useless behavior. It's
Mhm.
like you're not really doing anything. You don't actually understand disease transmission. And, so I know CDC says it, and I like the CDC, but in this area, they tend to lie.
Mhm.
Um, I think surgeons should like wash their hands.
Yeah.
But the environment's actually pretty contaminated. There are a bunch of diseases that are airborne that the shopping cart's going to do nothing. Colds, flu, and COVID, all airborne. I don't care if it's on a surface, because I can't really get a viral load on my hand. And if I get a viral load of any of those on my hand, to get it, I'm going to have to shove my fingers up my nose and inhale it. If I don't do that, I'm not getting any of those, but I'm breathing the air. And the question is, am I going to, where am I going to breathe and not breathe the air? I could wear a mask always. And maybe I
But that's
don't know how
not
much that would
quite
help.
enough. Not quite
Well,
enough,
yeah, well,
though.
you can't go to restaurants, period. I love
No.
people who wear a mask and then don't wear it in a restaurant. It's like, I'm sorry, this makes no sense. Like, do it or don't do it. At least,
Right.
and I think OCD, the way we measure severity is consistency. The more
Mm.
consistent you are, no offense, the more messed up you are. Everybody says, I don't want to eat off the floor or touch, do anything on the ground. But, you have a 2-year-old, most people without OCD will sit on the ground, they're touching the ground. They don't know where their hands are. The kids sticking their hands in their mouth. But if I have OCD, it's like, yep, I'm not doing that,
Right.
And so the more consistent I am, the more narrow my life is.
You know, I
So,
wanted to bring something up, and John had mentioned this sort of like what you're giving up, right? What you're giving up. And this is something that we actually haven't heard from Valentina yet, I don't think, that I'm very curious to hear, because there's a reason why she's reaching out for help about her symptoms and to gather information and to consider, you know, doing things differently. There must be something in her life where she's saying, this is things are not going well, or I'm giving up too many things in order to accommodate my
and since
OCD.
she hasn't popped on yet, I have a guess, but might be wrong, and she can correct it. Because a
What's your
lot of times
guess?
people with OCD, the big issue is, I know the bad thing can happen, but I don't want it to be my fault.
I hear that a lot too.
Yep.
As if like,
Yeah.
which I was a little confused about. Like, I have children. It's like, my house is clean, so they're not getting it from me. But it's really a danger. Why are you letting them out? I mean, okay, it's worth to let your kid die, so you're letting them out of the house as long as it's on them. Um, Again, everything is odds, and I think the hard thing to accept is there is no safety. There are low odds and high odds, but low odds are not no odds. So, the best I can do is hope to cope. I don't get to say, I
I'm
just
always
hope.
amazed at how just regular people are so so inconsistent, and with some things they're like, oh no, that's such a dangerous thing to do, and it's like, no, it's not.
Yeah.
It's just
Do you have
odds.
an example that you're thinking of?
Driving.
Yeah,
You know
big
what?
one.
And you know what I like about that? You just said, Zach, driving is probably way more dangerous than me putting my hand on the pavement and sticking my hand in the mouth. You want to know what's going to more
Or
likely to kill me?
doing
Driving.
ABC gum.
Yeah. Well, I was picking a safer one than ABC gum, but yeah. But
Oh, here's
Here
Valentina.
we
You guys
go.
want to hear what she says?
This is awesome.
Oh, yeah, I love it.
She gave us more material.
My therapist
um,
says it's unhygienic not to wash hands after touching the mop
I don't know what
handle.
unhygienic
I
means
don't either.
because I think again my thought is, what are the odds of getting sick from it?
Yeah,
Because like, I'm sorry, if you're a janitor, you're like, because I did janitorial work. I didn't realize that my janitorial work was actually preparation training for being an OC therapist, but it turns out it was. But
That explains it.
you know, but you might come into contact. But the thing
Yeah.
is, oh, Valentina answers her own
Valentina
question.
knows. Yes, she answers her own question.
Yes,
Thank you,
yes.
Valentina.
Valentina, no offense to your therapist, she clearly is not an OCD therapist,
No.
Right.
because
Yeah,
because
and
because
Valentina
anybody who
understands
wait,
OCD.
for all of us, like an employment question we would ask of a therapist is like, how do you feel about rubbing your hands on the toilet and sticking your hand in your mouth? Um, interviews over. Interviews over if they say they wouldn't do it. I mean, I don't say you're not hired then, but it's like, I can't work with you because I feel it's important for the therapist to do the same things, not because it's safe,
Mm-mm.
but because the odds are low enough that I think it's worth to model it. But um, unhygienic. I think it's cute because in the course of a week, there's at least 2 to 4 times a week where I'm rubbing toilets, just sticking my hand in a dumpster, piercing a bag, and then sticking my hand in the mouth. And I've only been doing this since 1978. But also think of how many clients I've done this with. And then think about, I'm not unique among OC therapists. So there are like hundreds of us doing the same crazy thing. And there's not like this incredible, not like all of us said, like, this is really great therapy. I mean, I've lost a couple of people along the way, but it's worth it. Uh,
OCD
no, but
therapists have a higher
so
propensity for
yeah,
cancer or
so
something,
so it's not like I'm saying it's safe but bottom line is it's low probability.
That's right.
The OC
Correct.
convention, I take out 200 to 300 people at night. we do exposures, and I have them, everybody putting their hand in the dumpster, sticking their hands in their mouth. So in
And he
25
certainly
years,
does those things. Just to let everybody know, I was there on the streets of Chicago with John, and he has a bullhorn, and he's
and
not
nobody
get
has
it.
to do it. We just encourage them.
I gotta
And
see
then,
this
and then we end
sometime.
by going to the bathroom, rubbing our hands on the toilet, and then eating Tic Tacs with our contaminated hands. Is it unhygienic yet? Does it sound disgusting? Absolutely.
yeah,
Disgusting and dangerous are not the same thing. Zach
right.
mentioned ABC gum because we also did at the convention a little thing with ABC gum, already been
Yeah, that
chewed.
was really gross, but yeah, that
And
was really
but
gross.
I always like to point out why that's normal. And the reason it's normal is for a vast majority of
Wait,
people
did you say what ABC gum is?
already
Does
been
everybody
chewed.
know?
Yeah.
Already been
Already
chewed.
been chewed. I actually didn't know that. And when John said he was going to pass out ABC gum, I'm like, oh, I might like
Lewis
this
wants
new
to buy you
ABC gum.
mouthwash.
So the thing about the ABC gum, why is it normal? And the answer is, in college, how many people did you French kiss without knowing their history? And what do you think? And what do you think is more dangerous? Fresh spit from a person you don't know their sexual history, or 10-hour-old gum, which is as good as you've just put it out. Is it risk-free? No, but let's face it, most people choose to take the risk. Is French kissing fun and 10-hour-old gum disgusting? Yes, but we're talking danger. I used to work in an office, and my wife was in the office next to me, and I had a lot of my clients go, does your wife know what you do? Does she kiss you? And they're like, I don't believe you. So if Kathy wasn't
Well,
seeing somebody, I'd knock on the
let's put
door.
up Lewis's comment.
Wait. So what would happen is I would call
Oh,
Kathy into my office, and she'd come in, and they'd look at her and said, do you know what he does? And she'd look down and go, yeah. And then
Yeah.
she'd kiss me, and then she'd go back into her office, because does she think what I do is disgusting? Yes, but she doesn't have OCD. So, the idea that mouthwash would fix it, well, it might make my breath fresh, but you might as well get me a mint because, and again, once I've imbibed it, it's no longer in my mouth, it's in my body. So,
yeah.
but, actually, and I've been waiting to get the OC client with this problem for real. Because,
Okay.
actually, there's evidence
It's like your white whale client.
that the thing that I'm doing is actually increasing the biodiversity of my microbiome, which is actually making me more resistant getting sick. So
Yeah.
I'm looking forward to the OC patient where I have to say, no, you can only go in the dumpsters 10 minutes once a week. You cannot spend all the time in the dumpster improving your microbiome. Um, but the bottom
Uh,
line is statistically, there's a difference between gross
John's
and
going to
sick.
outlive us all.
Well, so far I am, but
well,
it's a race and I'm not likely to win.
the the good die young and pricks live forever, though.
But I know cockroaches live forever. So the whole point is, yes, what are most people actually doing versus what do they think they're doing? I had a mother who told me that she didn't have OCD because her husband had the OCD. He said, but there's sometimes you got to wash your hands. Like
Yeah.
when? She said, well, I take my kids to the children's zoo, and when we
Because
leave
that's
the
the
zoo, I have them
cleanest
wash
place
their
on
hands.
earth.
Well, no, but then I have them wash their hands afterwards. And I said, before they eat. And I said, do you eat right after the zoo? She said, no. I said, okay. I said, how old are your kids? 3 and 5. Do your kids put their hands in their mouth? And her face like dropped because she realized that while they're at children's zoo, they're putting their hands in their mouth.
Yeah.
It's actually not a useful behavior. And everybody goes, E. coli, oh my God, blah, blah, blah. And although, first of all, when I was a kid, there were no Purell, nobody, you went in the children's zoo, nobody was getting crazily sick. All the kids who stick their hands in the mouth before they leave the children's zoo are not getting sick. And here's the real lie, because it's like, what if they get E. coli? But anytime anyone gets E. coli at a children's zoo, what happens? They kill all the animals. No,
Really?
you
What
get
are
rid of
you
the
talking
animals. They're,
about?
it's like E. coli chicken. It's like, sorry, we got E. coli. Get them the hell out. We don't have, it's like, that's it, And again, you never hear if somebody gets sick from eating contaminated chicken, they never go, what an idiot for not properly prepping the chicken. They go like, Get rid of all that chicken from the
Get rid of
stores.
all.
So
True.
it's not like it's not like I'm
This would
saying
be a
don't
real
wash.
news event.
I'm not saying
If they
don't
killed
wash.
all the
I'm not saying
animals in
don't
the
wash
zoo.
hands. But I'm just saying there's an overemphasis on it, and there's
Yes,
places where people who don't have OCD don't know what they're doing, which many
Oh,
people with OCD will agree. And it's like
absolutely.
that's right. But here's the thing: they don't know what they're
I'm
doing,
way too
and they're
lazy
not
to keep
dropping
track of
off
that.
like flies. And again, if these things were dangerous, we should have no OC therapists in my age group, because all of us
that's
have been
true.
doing it for like 20 years. So like if this is gonna kill us, we should be dead.
That's
And like
right.
we're just clinging on because we're improving the diversity of our
There
microbiome,
you go.
and you're not.
All right. We have to make sure to leave some time
That's
for an
hilarious.
important question that we were supposed to address today. And I think this is one that if you're an OCD therapist, you've heard many times from many patients with many types of OCD, which is this question that comes up. And it usually doesn't come up the first day of therapy. It usually comes up after you've been in therapy for a little bit, that somebody will say, "Are you sure this is OCD? What if you're wrong? What if this isn't really OCD?"
That's such an
Zach, wait.
easy.
John, I'm going to stop you. Zach,
Thank you.
I want you to go first on
Thank you
this
for
one.
stopping me. Go on.
I know.
It's my best guess. You're gonna have to learn to live with that.
It's your
It's
best
funny.
guess.
There was a situation uh like that recently. Um, have you ever heard of either of you heard of the book slash movie Brain on Fire?
Yes, yes.
Yeah. So this is why the backbone of how I do treatment and why I look at what John has done and respect his work, because uncertainty just makes the most sense to me. And I have 15 years of experience working with first episode psychosis, and I know exactly like the stats and all that sort of thing. But
You know what to
I'm
look for with
I know
first
what to
episode
look for,
psychosis,
all that,
right?
yeah. And I also know that we don't know everything, just like we don't with OCD. And so there can be instances where I won't be right. I hope and I try the best I can, but I
Right.
don't have those guarantees that, people are looking for. So much
Right.
like a person, brain on fire, it's autoimmune encephalitis. They can have both OCD symptoms, psychosis, but it's not actually those, it's actually the brain.
Right.
So the treatments don't work
Right.
because they're not treating the actual problem. So that's where I go back to, it's my best guess. I could be wrong, you know. Let's operate on these assumptions. If we're proven wrong in the future, I guess that's when we'll make a different choice.
Right.
And
And
this,
I think, what Zach is highlighting there is the importance. And, this I think is a good kind of metric to consider whether or not you're in therapy with the right OCD therapist. If you're going to your OCD therapist and you're saying, what if this is an OCD? Are you sure I have OCD? And if the therapist is continually saying, no, I'm absolutely positive that this is OCD and it couldn't be anything else, the problem is that question you're asking because you're looking for reassurance and you're looking for
Yeah.
certainty. And so a good OCD therapist is always going to hedge their bets. They're always going to say, I'm pretty sure this is OCD. I've been treating this a long time and I know these treatments work for this set of symptoms, but could it be something else? Well,
I would
can I be
probably only say
100%?
that once, and then the next time it's asked, I'll be like, I already answered that. Let's move on.
Yeah, I completely agree. Completely agree.
and
John
of
is,
course,
yeah,
there's like, if somebody is asking that question,
yeah,
I feel
Yeah.
really safe in saying that question is OCD.
Huh.
That's a problem. And as you pointed out, they're looking for some reassurance, and it's hard to know which way it is. They want reassurance that they're getting the right treatment so they'll get better, or they're looking to know that it's OCD so they don't have to worry about the other thing, as if it's OCD, they don't have to worry about the other thing. I always like to point out it can be OCD and like, I'm having,
Yeah.
you might be a killer and you have OCD about it, but I'm gonna wait. I need, currently it looks like OCD, so we're gonna act like it's OCD, um, until we have certain confirming information. Like if you
Right.
say to me that you have no doubt, and this is really important because when I give this suggestion, they go like, maybe I think that's all right. You said maybe. If you have no doubt, like the best thing in the world seems to you, like you would like to grip a little 5-year-old's throat and start choking the life out of him and watching his face turn red with terror, and that like seems fantastic to you. I'm going to start to think that there might be some stuff other than OCD or in addition to OCD. But I need for that to be a definite, like, no doubt thought. If you have doubt, I'm going to pretend that it's OCD and treat it that way until we find out otherwise. And if it's harmless to me,
Pretend? What?
I'm just going to hope that I'm not the first victim. Because
That's awesome.
have an order. So so again, is it OCD? And the person who wrote that question, they were going like, maybe my therapist doesn't want to upset me. I always tell my clients, and of course they're stuck believing it or not, but like, I will not lie to you to make you feel better. If you've got something and it's nasty, I will try to find a gentle way to tell you it, but I won't lie to you. So I can definitely be accused of being wrong, but to lie to you to just make you feel better just seems stupid because it's like, great, you're going to feel better, but I'm sending out like, oh, they feel good right now. Too bad they're screwed. Like that just seems unethical. So
Yeah.
if you're being treated by a therapist who's tricking you, then you're screwed. Now, is
Right.
that possible? Again, we're just going with odds. I hope I have a good therapist who knows what they're doing and who understands that truth is probably more important than me just feeling good. If I just need a pat in the head, I probably don't need to spend a lot of money for it.
Right. That's true. And that was the other question that was posed to us, this idea about, what if my therapist is lying to me to save my feelings because they don't want to hurt my feelings, but really I am this bad person that I fear I am, right? Sort
Yeah,
of
I
this
would tell
fear
them
of
that.
like, yeah,
I mean, if somebody has, like certain with certain forms of OCD where people are upset about something they've done in the past, and they've
hmm,
actually done it, because we have people who are afraid to, but they've actually done something in the past.
Yeah.
right,
Um, I'll say, yeah, you should feel bad about that. That was a bad thing.
right,
But the problem is that you're not moving forward. Like it doesn't do anybody any good you doing what you're doing now. I'll ask them, do you know what forgiveness is to yourself? It doesn't mean you don't feel bad about it. It means you think you are changed and different. And so you'll forgive yourself for, you know, not knowing as much back then or being not as enlightened. So you hope you're better now and you'll forgive that person then. But if you want to get rid of the bad feeling of having done that, that's not part of it. I mean, if
yeah,
I run over a kid by mistake, I'm actually, it's not my fault. The kid ran on the street. There's nothing I can do. I ran over him, heard the dull thump, and saw the squashed little body. That's going to be a sickening memory always.
yes,
I'm not going to, it's not like, well, it wasn't my fault, so I'm cool.
Moving
I'm
on.
always, yeah, yeah. It's like, I can accept, I will accept that it wasn't my fault, but I still will feel bad about it. So if I've done something bad, yeah, that's a bad memory. And the best I get is, I hope I'm different than I've learned.
right,
And I say, I hope I'm different. If the OC person says, well, how do I know I'm different? It's like, sorry, that's OCD, unless you're telling me you're planning on doing it again. You're planning on doing it again. Okay, you should feel bad, and yes, you're continuing bad. But if you're afraid you're a bad person, let's act like it's OCD. And I always say, let's act like it's OCD as my way of, So the question is it real or not? It's kind of not relevant. The question of is it OCD or not? That's an OC question, and the thing you
Right.
have is OCD. And are you a terrible person? I need, let's talk about how you're going to cope with that.
And it's interesting, you sort of touched on, it sort of harkens back to this other conversation we were having, like this idea that it's not necessarily the OCD thought. It's like this, it's not the actual fear of the thing happening. It's more, what if I'm the person that's the one to blame for this thing? What if I'm the person that's responsible? And then I have to live with that feeling, that dreadful feeling forever of knowing that I did this horrible thing. And what if I can't then tolerate that terrible feeling, all that blame, shame, etc.
And treatment is learning to cope with that.
Learning to cope with that.
Because
Exactly.
we don't have a choice.
Because bad things happen sometimes.
Right. And
We have
bad things
all
are
we have are
sometimes,
the odds.
and sometimes they're our fault, and sometimes we make a bad decision.
That's right.
And success is not making the right decision. It's coping with the consequences of whatever decision we made.
Exactly. All right. We're right
That's also
there,
part
right
of
at
being
an hour.
responsible.
That's true. That is true. All right, we're right there at an hour, guys. It was a wonderful meeting today. Thank you so much for the people that participated here.
Valentina and Lewis.
Yeah,
Great
hopefully in just about a month we'll have. But the questions today were just terrific. I mean, all the people that participate in this program, it's like we know that we've said it before that folks with OCD tend to be of higher than average intelligence, and the questions that we get are always such good questions that are such rich questions for us to respond to. And so thank you so much for the participation. Thank you to the two people that chatted in today. And thank you to my co-hosts. We'll see everybody in about a month.
Katie.
Oh, thanks, Zach.
Yeah.
Rare praise from Zach. All right, take care. Bye.
Take care.
Bye.